My name is Megan Robinson, and I'll be doing my presentation on the mumps virus. The mumps virus is a viral illness that is caused by a paramyxovirus. It's a member of the rubeolovirus family, and it primarily affects the parotid glands. As you can see from that photo, the parotid glands are the salivary glands that are located below and right in front of your ears. The average incubation period for the mumps virus is anywhere between 16 to 18 days. Humans are the only reservoir of the mumps virus. There are no vectors that transport the virus like mosquitoes. People can, however, be asymptomatic and may transmit the virus unknowingly to others. The viral genome of the mumps virus is a single-stranded RNA genome. Symptoms of mumps include a swollen, painful area on one or both sides of the face. It can also include fever, headache, muscle aches, weakness and fatigue, loss of appetite, and as you would guess, if your face is swollen on one or both sides, you're going to have pain while chewing and swallowing. It's often called the puffed out cheeks disease. The virus is transmitted easily from person to person through infected saliva. So if an infected person is sneezing or coughing in the area, if you do not have an immunity to the mumps virus, then you are very likely to contract it. Sharing utensils or cups with someone who has mumps is also a good way to spread that virus. It also is more easily spread among people who live in close quarters. So people that live in college dormitories, there's a lot higher chance for them to contract mumps. Some complications of mumps include, the most common is inflammation, and it can be inflammation in multiple areas of the body. Testicles in males who have gone through puberty can sometimes become inflamed, and if not treated, that can lead to sterility. The pancreas can also swell, causing pain in the upper abdomen, which will also cause some nausea and vomiting. Females who've reached puberty can have swelling in the ovaries and breast, which is more rare, but it can also lead to sterility if not treated. The most severe inflammation would be inflammation of the brain, which could lead to neurological problems and could also be life-threatening. This is a very rare complication, but it does happen. Meningitis can also occur if the mumps virus spreads through the bloodstream, and it would infect the central nervous system. Besides inflammation, hearing loss in one or both ears, depending on which side the swelling is on, can occur. And women that are pregnant have a much higher risk of miscarrying if they have mumps. The best way to prevent mumps is to get the MMR vaccine. That's the measles, mumps, and rubella vaccine. It's recommended to have two doses of the MMR before the child enters school, and a lot of schools require that before a child's allowed to be enrolled. The first dose occurs between 12 and 15 months, and the second occurs between ages 4 and 6, or if you miss that dose, between ages 11 and 12. It's not recommended for women that are pregnant, people who have severe allergic reactions to gelatin or the antibiotic neomycin. Also, those that have a very weakened immune system and people that take oral steroids, it's not recommended that they have the MMR vaccine. A little background on the vaccine. The U.S. didn't start the vaccination program until 1967, and before the vaccine was started, mumps was very common in the U.S., and as you can see from that chart, it has very significantly declined. In fact, the vaccine has caused a 99% decrease in mumps in the U.S., and outbreaks still occur. Like there was one outbreak in 2006 on a college campus from kids that were living in a dormitory, and that it was spread very easily among them, even to people that had the vaccination, and it resulted in more than 3,000 cases of mumps. some treatments for mumps. Since it is a virus, antibiotics are not effective against it. The best thing that you can do is just treat the symptoms, because mumps will usually run its course within 2 weeks. So rest, over-the-counter pain relievers, ice packs, and fluid are the best options to remain comfortable while you're waiting on that virus to pass. The only time that you would really want to make sure that you sought immediate medical attention would be if you acquired a fever of 103 degrees or greater, you had trouble eating or drinking, you had confusion or disorientation, there's abdominal pain, or there's pain and swelling of the testicles in boys that were past puberty. So, in conclusion, mumps is nowhere as near as common as it once was. It has been significantly decreased in the United States due to the vaccine. If you do, for some reason, contract mumps, the best remedies are time and rest to treat your symptoms. And the best prevention for mumps is to remain up to date on vaccinations. Thank you.